Hi everyone, my name is Christina Bowie, and my research project will be researching autism spectrum disorder. So basically, what is autism spectrum disorder? It's a developmental and neurological disorder that affects a person's communication, social skills, and behavior. The symptoms of ASD is often discovered in early childhood. This disorder affects majorly how a person interacts and communicates with others. The social interaction with peers is often discomforting and incoherent, causing a lack in social interaction, le- leading an ASD patient feeling lonely and emotional distress. Social disconnect affects daily living and regular interaction with others. Early intervention methods can help many of the social interaction symptoms associated with ASD. So, the research question that I am looking to answer is: do social intervention methods help to reduce social disconnect in ASD? The importance of this topic and research question is because there is no cure for ASD, and due to a broad spectrum range and it often causes difficulty in intervention methods. Early intervention methods are vital as social interaction is a huge part of a person's daily living. So, I researched and found two literature reviews. One found one intervention methods such as teaching social skills to ASD through an iPad can have great benefits on social interactions on the playground. A multi-probe design was used in the study and demonstrated through using a social story on an iPad that ASD kids were more likely to give compliments to peers at the playground after the intervention method. The following methods were used in this collection: data informal interviews, autism social skills profile 2 on each participant, observation, and a checklist. The intervention method proved to be effective, showing evidence that social interaction can be improved in ASD. That was the first study. Another study found a pharmacological intervention that explores a social communication impairment in ASD. The study found that medication could be a significant treatment option when targeting social impairment in ASD. A sample study of 6 children with ASD found significant improvement in social withdrawal and social responsiveness, with 5 out of 6 participants showing a positive change. And this was found by Barber and Augusta in 2014. The following methods were used to collect data in a search of several databases that review prior testing. Evidence with some research supporting rational drug discovery is surveyed. The study found that pharmacological intervention as well as behavioral intervention methods can show evidence of improvement in social communication in ASD. So, some descriptions of potential methods that could be used to answer my research question would be: I would personally use a mixed method design using the interpretive approach, which would best suit to help answer the research questions. Do social intervention methods help to reduce social disconnect in ASD? The sample study will consist of 10 ASD chosen randomly using the explan- explanatory sequential design as the quantitative approach is priority. In this study, the research question will be asked and then it'll move right into the mixed design. A descriptive statistic, which will describe the sample study, will be broken down into measurements to provide a sampling framework for 8 weeks. Through this observation of 10 ASD students using intensive teaching to teach friendship and being kind will be observed on the playground. social interacting with peers while collecting data through a questionnaire after the social interaction. After data has been gathered, the data will be interpreted and analyzed, followed by the results of the study. While using explanatory sequential design, an increase in generaliz- generalizability and validity can be proven. So the ethical concerns in this study, we would look at section 8.05 in the ethical codes. This is dispensing informed consent. As ASD has a variety of symptoms and is a neurological disorder, possible harm or distress may not be recognized right away in the sample study. The teaching of the social interaction may also be off track of normal educational practices and curriculum. So, the conclusion of the study, there is no cure for ASD. However, with intervention methods, many can function and live their daily lives. Social skills is a major discord in ASD, often affecting a person's lifestyle greatly and can be effective and can affect a person's emotional state. There are no intervention methods that can help ASD patients into the social world. With effective treatment, however, further studies would need done to see if those intervention methods would work, as this study is to help gain further knowledge of ASD in the social world. And that is the conclusion of my research design.